I'm Carol Stokley, and I'm from Brights Grove, Ontario, which is just outside of Sarnia, Ontario, a small community. How I got on this path with CTEPH, basically, I just couldn't breathe. For my age, in excellent health. I've never been sick. I've worked. I have 4 children. I've had naturally no problems. I was widowed at a very young age, and I raised my 4 children on my own pretty much. Worked very hard. I went to the gym. I ate well. I didn't smoke. I looked after myself. I had the odd glass of wine here and there. I lived a really good life and I worked really hard. And then when I got sick, I went to my family physician and I told her, I said, I just can't breathe. And that was in the fall of 2021. So I went twice. I went in September. I went in November. She sent me for a chest x-ray and said, you know what? I don't see anything. There's nothing there. And I kept thinking, there's something the matter with me. But I was trying to continue my busy life. At this point, that was just a few years ago. So my kids were raised. I was living on my own. And when I went to the doctors, I thought, well, okay, it's in my head. I really thought it was in my head. So I was trying to live my life. January of 2022, I went downhill skiing in London. And this is when COVID was starting to lift. So we could do stuff. We couldn't go in the ski lodge. I skied for 2 hours downhill. I'm not a great athlete, but I've done stuff. So I went skiing with my 30-year-old daughter. I didn't feel too bad still. So then we booked a trip to go to Cuba, my daughter and I. And again, this is when COVID was lifting and we could travel a little bit. So went to Cuba and I was really short of breath there. And I'm not sure if it was the air pressure on the plane. Came home, went to my doctor's again. And I said, you know, something's the matter with me. I just don't feel right and I can't breathe. And again, chest x-rays, couldn't find anything. So in March, I was in ICU at Blue Water Health. So what happened was on a Wednesday, I couldn't breathe. Told my daughter, again, I live alone and she lives about 15 minutes away. And the next day I couldn't breathe on Thursday. And then Friday night, I thought, I really can't breathe. So I said to my daughter, and I have 2 dogs. I said, you know, if I can't breathe in the morning, I think I got to go by ambulance to the hospital. Something is the matter with me. Saturday morning, I got up and I literally could not walk from my bed to my ensuite bathroom. I didn't faint, but I called my daughter immediately. And I said, you know what? Call an ambulance. Come take my dogs. I've got to go to the hospital. Paramedics came out. Personally, what I thought I was having, and I told the paramedics, and I was coherent, I thought I'm having a silent heart attack because I didn't have pain. But, you know, this is what I've read. Women have silent heart attacks. So I told the paramedics, I'm sure I'm having a heart attack. So they started with the nitro under my tongue, get me in the ambulance, and I have a 2-story. So I did get downstairs in my pajamas, but I didn't care at this point. And on the way to the hospital, my oxygen level was so low, like 78, 75, 73. And even with the nitro, it wasn't going up. And I had the oxygen mask on. I've never rode in an ambulance. I've never been really sick, not in the hospital, except to have my children. The ambulance pulled over, and I'm sure they thought I was having a heart attack too. So more nitro under the tongue, get me in the hospital. And from Brights Grove to Sarnia, it's about a 15-minute drive. But I remember looking up at the ceiling. They were flying. Anyway, as soon as they admitted me to Sarnia emergency, they thought I was having a heart attack. So immediately I had excellent care. Went into ICU for 10 days. And this is when I found out I had an embolism in my right leg, and it had worked its way up to my lungs. After 10 days, I went to telemetric for a couple of days. They sent me home on my blood thinners, got me all kind of sorted out as best they could. And then onward from that, I had Dr. Haddad at Blue Water Health. He was excellent. And Dr. Chetty. And then I've saw many doctors since then. So that's kind of how I started. They didn't tell me I had CTEPH when I was in the hospital. It was after I went to another doctor, Dr. Al Sabaidi in Point Edward, Ontario, just outside of Sarnia. He's the one who told me, got me scans, and this would have been probably in the summer. So I had to wait a couple months still, but it was on my blood thinners. The blood clot was gone in the right leg, but I knew I had other problems. So I thank him. He got me to Dr. Mehta, is actually my doctor, Sanjay Mehta, and he's been a dream. He got me to Toronto, and I got my surgery actually a year later. But I went from this extremely healthy woman to in ICU, which is, to me, unbelievable, the journey. But I've been very fortunate, and I'm feeling fabulous now because of this surgery. They did a scan at Blue Water Health. Dr. Elzabida, the respirologist, knew something was the matter. And after the scan, he immediately saw me and started to explain what CTEPH was. So the embolism was in my right leg. It had gone up to my lungs. And then what it does, it attaches to your lungs. I'll just say it. So it's the scar tissue. So all those clots had attached to my lungs. And what was happening is it was making my right ventricle, my heart, work overtime because my lungs weren't functioning properly. So my heart's getting larger, still can't breathe really properly. I was functioning, but I wasn't back to the gym. There was a lot of things I still couldn't do. But Dr. Alzabaidi, after he diagnosed me, got me to see Dr. Mehta almost immediately. Dr. Mehta did all the tests. He was so good. And again, that's about an hour away from me. And I did have my surgery in Toronto, and that's like 3.5 hours away from me. But Dr. Mehta, after that diagnosis, he knew what to do. He got me on the path. That was March of 2022, and I had my surgery May of 23. So it still was a year to wait, but I was functioning okay on my own. For example, I have 2 dogs that I could walk 10 kilometers a day. I was a very active woman. I mean, I couldn't hardly walk 2 blocks. I have a 2-story house. By the time I get top of the stairs, I'd be breathless. Like I'd have to sit down and catch my breath, and then I could continue on. But as I said, with Dr. Mehta, he worked with me. I was on my blood thinner. And then eventually I went to Toronto General with Dr. Mark DePerot, excellent surgeon, a dream team at Toronto General too. They were so good. Their ICU unit. I mean, I can't say enough about the medical practice. I guess in the beginning with my family physician, and this is, I think, something to do with it. Family physicians aren't aware. I have an excellent family physician and she listens to everything I say. But again, I think they're just not aware of what some of this is, that's going on when you can't breathe. Maybe me being older too. Maybe she thought there's things that I'm older, but I've been a picture of health, really. I've been really very healthy to go to one extreme to another. So I was admitted. I went in and they told me to bring 16 days of pajamas and clothes and whatever for recovery. So I go in, get all my testing done a couple days before. I'm scheduled for the surgery 8 o'clock in the morning. And I meet this whole team at Toronto General Hospital in the operating room. And I'll tell you, it was a team of about 18 people. I'm laying on the stretcher, whatever, to have the surgery. And I can remember, and I'm very coherent, they go around the room, they introduce me to the nursing team, to the anesthesiologist team, there were people observing up top at a window that I had to say, is that okay? And I'm like, sure, students that were going to learn about this. And this team was just amazing. The doctor had not come in yet, but he was on his way. But the anesthesiologist was so good. And I remember saying, please make sure I come out of this. I got a lot to do. I've got kids. I've got an elderly mother. I've got a grandbaby. I want to be able to live. And they were so comforting to me. For the surgery, it's pretty much an all-day surgery, and they go in and cut the sternum, and I have staples in my sternum now, which is kind of like a knee. I believe it's titanium, and I can travel. I don't ding at the airport, but they do know that I have the staples. They'll never come out. The staples stay there forever. So they basically cut the sternum, open you up, and then scrape the insides out, scrape your lungs out, the arteries, and get all of those blood clots out. So you back up and send you into ICU with a breathing tube. They told me all of this, that I was going to be medically induced and in a coma. And the one thing that they did tell me, and I guess this is something I remember, there, when you wake up, you'll not know how long. You could be 2 days, 3 months, 3 days, 3 years, and so that you would lose track of time. Anyway, I did wake up that night, and I remember putting my hand up and waving, and I thought I was waving to the ceiling, and I probably was just lifting a finger. But I do remember waking up that night. Well, they medically induced me again because it was too soon. I actually woke up the next day at 4 o'clock, and normally it's about 3 days. But I did come out of the medically induced coma, came out really well, and I was out of the hospital in a week, which in 8 days, they were going to release me, got me out of ICU, and they were going to send me home on a regular floor. And I was like, please don't send me home yet. I don't think I'm ready, because I expected to be there 2 weeks. And also I live alone. My daughter came and stayed with me. But because I live 3.5 hours away, I didn't want to go home too early, and then I'd have to race back to Toronto. They tell me it's only a once-in-a-lifetime surgery, so I hope it never comes back. But who knows? In 10 years, they might be able to do something again if it comes back. But I'm being positive that I'm never going to get this back, as long as I stay on my blood thinners. For my 4 adult children, they're all wonderful kids. My oldest son took me down there. and cried when he dropped me off because I said, don't stay, because I've been on my own a long time. They live in Sarnia too. So I'm like, just go home. I'm going to be okay. My daughter came down, though, just before I went in for surgery that morning. I have 3 boys and a daughter, and my daughter's my baby, and she's been my caregiver. My boys, too, but I put her through a lot. She stayed with me until I came out, and then I'm like, just go home. I'm going to be okay. I'm going to get through this. The ICU team at Toronto General, Ronnie was my nurse, I remember, and he was absolutely fabulous. And I cried when I had to leave ICU to go to another floor because he just was so good to me. And they were all just so good. So I was so positive I was going to be okay through this. I really felt it was a journey I was going to be on, but I'm going to be okay because I've always been pretty positive. Being widowed very young at 33 years old, 4 little children. My daughter was only 17 months old, which is a whole nother story we'll go into. But I've been a positive thinking person. I'm an only child. So as far as help, I've pretty much what happens next is going to be whatever. I think for the whole surgery journey, my kids were worried, but I kept telling them, I'm going to be fine. I'm going to get out of this and I'm going to be back to the person I am. And I am. I wouldn't say I'm 100%. But I'm also a little bit older, but I'd say I'm 97% back to the person that I was. I was going to tell you one little story about this medically induced coma, about not knowing what time when you wake up or how much time's passed. So my daughter's in the room. I wake up completely disorientated, like I can't talk. And I've also got a big breathing tube inside, so I can't verbally talk anyway. And the nurse comes in and I said, I was concerned about the time. Like, what was the date? How long have I been under? I didn't hear anything. Some people say when they're in comas, or I've seen on TV, they hear people talking and this and that. There was nothing for me. So when I finally woke up, I was really concerned. 3 weeks, 3 days, how long have I been medically induced? So I tried to talk and I was trying to think of date and I could not think of the word. And I'm trying to say date, but I can't think of it. So then they get an alphabet chart with the nurse and my daughter's there and I'm going to point out the date. So I can't think, how do you spell date? So I'm like, okay, time. My husband's name was Tim. So I'm thinking, I know how to spell time. So with this pointy finger shaking, I get to the T and they're like, T. My daughter and the nurse, and I'm like, yes, thumbs up. I do an I, and then I do my M, and my fingers shaking. And my daughter blurts out, Tim, your husband's dead. Mom, our dad died 30 years ago. He's not here anymore. And she thought complete amnesia, right? She wouldn't allow me to get the E out for Tim. And I am going, shaking my head. No. And she's thinking I'm shaking my head because I've lost track of time. And I'm like, no, I'm trying to make you understand. I'm not asking about Tim, your dad. I'm asking about the time. So finally, when I get the nurse and her calm down, I get the E out. And I mean, we laugh about that story now because it just was, at the time, I was so frustrated and I was so upset. My daughter's crying her eyes out. She thinks I've lost my mind completely. And it's a cute story now, but at the time it wasn't so cute. I've always been the caregiver. So for me to flip-flop to the other side, to want people to care for me, it was very difficult. But now I'm back. I look after my granddaughter, who's 2.5, 1 day a week. I look after my mom, who doesn't drive anymore. I have 4 kids that I'm very close to. I'm so glad. I am now back to the caregiver, and I'm doing really, really well. Like, I just hope I keep on this journey. I've met some wonderful people, and I hope their journey will be as successful as mine. And that makes me teary-eyed, but I have really done so well. And the medical team, I can't thank them enough for looking after me and caring about me. And even Dr. Mehta, last summer, I had some breathing problems again, and it really scared me. And I got in touch with Dr. Mehta immediately because he's like, Carol, you have any problems, you contact me ASAP. And I was down getting tested and down to London, and I went to an allergist even because we thought allergies. I got a little puffer, which I don't use anymore, signs of asthma, but he was so good. And we don't know why that that shortness of breath came, but it did scare me just a little bit. But it's gone away again. So, I talked to him. Hopefully it never comes back. But I tell you, my medical team has just been unbelievable. Yeah, I'm on the journey to hopefully living another 20, 25 years. I'll be happy. I'm Carol Stokley, and I'm aware that I am rare.